So, dear friend, today we will discuss the anatomy of internal structure of pons. Okay, what are the structure is seen when we cut the pons, especially at the two level. We will see. Now, if you see the cut section of the pons cut section is divided into the two part, the ventral part and the dorsal part. Ventral part is small, okay, here, while the dorsal part is large one. Okay, and the demarcation of the ventral part and the dorsal part is by this trapezoid body. What is trapezoid body? Trapezoid body are the fiber of the cochlear nuclei which crosses in the midline to form the body. Okay, so this is the trapezoid body. Clear? So anterior part is known as the basilar part and the posterior part is known as the tegmental part. Anterior basilar part continue inferiorly with the pyramid of the medulla, while the posterior part, the dorsal part, continue with the rest of the medulla except the pyramid. Okay, so this is the dorsal part, this is the ventral part. Now, what are the features in the ventral part? And there are the two sections. We will see the this cross section, two section at the lower part of the pons here. Look here, if this figure here at the lower part here at this level and the upper part. Okay, if posteriorly, if you see at the lower part where the median eminence or the facial colliculus is seen here, and the upper part here where the superior cerebral peduncle is also seen, and especially the locus coeruleus here. So two sections we will study: the upper part through the superior cerebral peduncle and the locus coeruleus, and the lower part here where the facial colliculus is seen. Okay, so now the first part, the upper part. Okay, here cross section at the upper part here. So first we draw the diagram. Here, these are the outline. Here. This is the middle cerebral peduncle. Okay, here. So this is the ventral part. Okay, here the basilar part, dorsal part, the tegmental part. What about the this ventral part or the basilar part? Ventral part, the basilar part has a cross striations. Okay, here, and these cross striations are due to the horizontally running fiber which passes towards the cerebellar hemisphere through the middle cerebral peduncle. Okay, so these are the fiber here which runs towards the cerebral peduncle, the middle cerebral peduncle here. These are the opposite fiber. And these fiber, horizontal fiber, start from the Pontine nuclei. Okay, here. The Pontine nuclei which is present in between the fiber of the vertically descending fiber of the corticospinal tract here. Okay, so look here. Now suppose the red color here. These are the Pontine nuclei. Okay. These are the Pontine nuclei, and Pontine nuclei here, there are the descending fiber here. Okay. Here the descending fiber of the corticospinal tract or the corticonuclear fiber here descends through the ventral part of the pons here. Clear? So mainly now the horizontally running fiber are seen. Okay. In between they are the ventrally or the descending fiber of the corticospinal or the corticonuclear fiber descends in between on the ventral side here, these are the Pontine nuclei. So these Pontine nuclei give rise to the horizontal fiber, reaches toward the opposite side of the cerebellum through the middle cerebral peduncle. So this is the ventral part here, and ventral part is demarcated from the dorsal part. I told you this is the trapezoid body here. These trapezoid body are the crossing fiber of the dorsal and the ventral cochlear nuclei. Okay, so this trapezoid body we can say is in the auditory pathway. Clear? Now, behind the trapezoid body, there are the lemniscus system here. The horizontally running lemnisci are present here. The largest lemniscus here, this is the medial lemniscus here. This medial lemniscus we have seen in the cross section of the medulla. If you see the medulla here, cross section of the medulla here. Okay, the last time we have seen the cross section of the medulla. If you see the medulla, now medulla is continued with the pons. Okay, here. So this is the upper part cross section of the medulla where the pyramid is seen, and these are the lemnisci. Okay, so the structure is here more or less similar with the lower part of the this pons cross section here, except here the inferior cerebral peduncle here is merged, or it is ventral to the middle cerebral peduncle. Now these are the lemnisci here. Now this middle lemniscus present in the medulla in the upper part of the section. It is here anteroposteriorly located here, where the anterior part is fiber from the lower limb, the gracile tubercle, and the posterior fiber of the thorax here, and the upper part of the this abdomen, and these are the fiber of the cuneate tubercle here. Now when this fiber ascends upward towards this pons here, now this lemniscus rotate here. Okay, rotate. So what's the anterior portion rotates medially, and the posterior portion rotates laterally here. So the fiber of the lower limb is situated medially, or the fiber from the gracile tubercle or the fasciculus gracilis, while the fiber of the cuneate tubercle and the fasciculus cuneatus shifted laterally here. Clear? So this is the here. Now you are seeing this is the medial lemniscus here, which is now located arranged in the horizontal direction. Okay. Now lateral to the medial lemniscus here, this is the trigeminal lemniscus, and this trigeminal lemniscus is the fiber of the trigeminal nucleus here, which is located, and this is the dorsal trigeminothalamic tract here. Okay, here, which is situated on the lateral side. Now lateral to this here, again another lemniscus, that is the here spinal lemniscus, and the spinal lemniscus carry the fiber of the lateral spinothalamic tract. Okay, here, that is the pain and temperature from the body here, opposite side of the body. So this is the spinal lemniscus here. Clear? Now lateral to the spinal lemniscus here, now this is, if you see on the just here, these are the here. This is the inferior cerebral peduncle, and this is the middle cerebral peduncle. Okay, here, and this one here, this is the ventral spinocerebellar tract. Okay, here the dorsal spinocerebellar tract already enter into the here the inferior cerebral peduncle. It enters. So this is ventral spinocerebellar tract remains here. Okay, which passes just medial to the middle cerebral peduncle and ventral to the inferior cerebral peduncle here. Clear? Now anterior to this here, the spinal lemniscus here. Now there is another nucleus, this important nucleus here. This is the principal olivary nucleus here. This is the principal olivary nucleus, and this nucleus is the nucleus of the auditory pathway here. In relation to the principal olivary nucleus here, that the another two nucleus are here. This is the accessory olivary nucleus. Okay, here one, or this is here, and another this is here, just on the ventral side here. This one. Okay. So this is the principal olivary nucleus. Okay. This is the retro-olivary nucleus here. Okay. This is the retro-olivary nucleus. Retro-olivary nucleus. And this one is, this is the accessory superior olivary nucleus. Accessory superior olivary nucleus. Okay. So this is the principal superior olivary nucleus, and this is the accessory superior olivary nucleus, and this is retro-olivary nucleus. So these are the three olivary nucleus. This is known as superior olivary nucleus complex here, and these superior olivary nucleus complex are the arranged auditory pathway here. Clear? Then there is the central tegmental tract here. Okay, this pink color is here. Just a dorsal to the superior olivary nucleus here. This is the central tegmental tract here. Okay, here. And the central tegmental tract comes from the red nucleus. Okay, fiber from the red nucleus descend downward and enters to the inferior olivary nucleus here. Clear? Now, here just in the midline and posteriorly here, this is posterior to the lemniscus here, medial lemniscus here. This is these are the two nuclei. Okay, these are the nuclei of the trapezoid body here. Okay, or the corpus trapezoideum here. These are the nucleus of corpus trapezoideum or trapezoid body. This, okay, this trapezoid body, this fiber ascends upward and end into this here, this nucleus, the corpus trapezoid. Okay, here corpus trapezoideum. Lateral to this trapezoid body, accessory superior olivary nucleus is located here. Now, come on the dorsal part here. What about the dorsal part? In the dorsal part here, this is the here. These are the dorsal cochlear nuclei. Okay, and here this is the ventral cochlear nuclei. Okay, here. So these are the cochlear nuclei. This is the dorsal cochlear nucleus, and this is the ventral cochlear nucleus. Okay, here. And this is here, we have already seen, this is the ventral spinocerebellar tract here. Clear? Both sides. Now, just here, this is the important feature in this here, that the two motor nuclei are seen here. One is this is the here dorsalmost part, here the abducens nucleus. Okay, here, and the ventral to the abducens nucleus here. These are the facial nucleus. Okay, here. So this is the abducens nucleus. And this is the facial nucleus. facial nerve nucleus abduction. Okay, and here these are the fiber winds around the dorsal part of the abducens nucleus and descends downward. Okay, ventrally. Okay, and then passes through this olivary superior nucleus complex and then comes out at the pons, junction of the pons and the medulla, lateral to the pyramid here. Okay, here. So these are the fiber of the facial nerve here. Clear? And these are the fiber of the here. Here are the fiber of the abducens nerve. Okay, here. So abducens nerve comes at the junction of the pons and the medulla, while the here this facial nerve comes at the junction of the pons and the olive, at the region of the olive here. Clear? So this is the sixth nerve and this is the seventh nerve. Clear? Then on lateral to here, this is here other nucleus. This is the vestibular nucleus. Okay, between the abducens nucleus and the dorsal cochlear nucleus here, this area is known as the vestibular nucleus. Because we have seen vestibular nucleus here is present in the vestibular area. This is the vestibular area, lateral to the sulcus limitans and lateral to the median eminence here. Okay, so in this area here, the vestibular nuclei are present, and the vestibular nuclei are in the 4 in number. Actually, these are the present into the 2 row. Okay, one is a medial row. Okay, one is a lateral row. In the lateral row, there are the 3 nuclei. Okay, here, this is the superior, this is the inferior, this is the medial and the lateral. Okay, so these 3 nuclei, the superior, medial and the lateral nuclei are present in this pons here, vestibular nuclei, while the inferior vestibular nucleus present in the region of the medulla. We have seen in the vestibular, this area. Okay, here. This area we have seen this. This is the vestibular area where the inferior vestibular nucleus is present, while the 3 nuclei are present here in the pons here. The superior, lateral and the medial vestibular nucleus. So this is the vestibular nuclear complex, we can say here. Clear? So this is a vestibular nucleus. Then laterally here, okay, here on the lateral side here, there is the this is the trigeminal nucleus. Okay, here, spinal nucleus of trigeminal nerve and the tract here and tract. Okay, here. So it is in continuation of the trigeminal nucleus of the trigeminal from the medulla here. Okay, so laterally here, this is a trigeminal spinal tract of the trigeminal nerve and the nucleus. So same here on the both side here, if you see. Okay, this is a trigeminal nucleus and the tract of the trigeminal spinal nucleus trigeminal nerve. Now, lateral to the facial nucleus here. Okay, lateral to the facial nucleus, this area. Okay, here, green color, this area. Here, this nucleus is the nucleus of the superior salivatory nucleus here. Okay, here, the superior salivatory nucleus laterally here. Salivatory nucleus, superior salivatory nucleus gives rise to the fiber which passes through the facial nerve and supply the secretomotor fiber towards the submandibular gland, sublingual gland, and the palatine glands and the lacrimal gland. Okay, superior salivatory. And in between the superior salivatory nucleus and the facial nerve nucleus, again on the dorsal side here, dorsal to here, this is in this area, dorsal to the facial nucleus here, or in between the facial nucleus and the vestibular nucleus, we can say here, this is here. This nucleus is the nucleus of the Tracta solitarius. Nucleus of Tracta solitarius, which is responsible for carrying the sensation of the taste from the tongue here, and the palate and the pharynx. Okay, so this is this one. Okay, this is the nucleus of Tracta solitarius, dorsal lateral to the facial nucleus here. Clear? Then in the midline here, in the midline there are, and posterior to this here, the corpus trapezoidium, the two another tracts are here, which is in the paramedian position, medial and general fasciculus, and this one is the posterior one, anterior one is the tactospinal tract. Okay, here, this one. So these are the structure which is seen in the upper, lower level of the cross section of the pons. If you revise here, divided two part, ventral part and the dorsal part. Ventral part basilar part, dorsal part tegmental part. Ventral part, there are the horizontal running striations are seen, and these striations are due to the presence of the fiber. Horizontally running fiber start from the Pontine nuclei. Okay, and these fiber are in the pathway of the corto-ponto-cerebellar pathway here. The cortical fiber ends into the Pontine nuclei, and from the Pontine nuclei passes to the opposite cerebellar hemisphere here. In between here, they are the vertically running fiber. These are the vertically running fiber of the corticospinal and the corticobulbar fiber and the corticonuclear fiber. In between, they are the Pontine nuclei. This is a trapezoid body which demarcates the ventral part from the dorsal part here. This trapezoid body are the fiber of the dorsal and ventral cochlear nuclei, which passes through the this auditory pathway. Just behind here, there are the three lemnisci are present, or the medial lemniscus, the trigeminal lemniscus, and the spinal lemniscus here. This medial lemniscus, okay, fiber of the fasciculus gracilis cuneatus ascends upward here, and this is the trigeminal lemniscus. This is the trigeminal lemniscus is the fiber of the trigeminothalamic tract here. Okay, here this is the trigeminal lemniscus. Okay, it passes through the dorsal trigeminothalamic tract, passes here. Clear? Then lateral to this is the spinal lemniscus, where the lateral spinothalamic tract passes here. Then laterally here, this is the middle cerebral peduncle, medial to middle cerebral, inferior cerebral peduncle here. Ventral to here, this is a ventral spinocerebellar tract here. Okay, and here the two nuclei, the dorsal and ventral cochlear nuclei are here on the dorsal and ventral to the middle cerebral peduncle here. And further anteriorly, if you go here, this is a superior olivary nucleus complex here. This is the principal superior olivary nucleus, and this is a retro-olivary nucleus, and this is the accessory superior olivary nucleus here. Okay, so this whole is known as the superior olivary nuclear complex. This is an auditory pathway. It comes in this pathway. Clear? Then further go, dorsally here, we have seen here, this is the central tegmental tract here, this one. Okay, central tegmental tract here. This central tegmental tract here, which the fiber from the red nucleus descend downward and enters into the inferior olivary nucleus. So this is the central tegmental tract here. Clear? And then further dorsally here and the medial side, the two important nuclei. The dorsal most is the Abducens nucleus, and ventral to the Abducens nucleus, and laterally is facial nucleus, and facial nucleus give rise to the fiber. Okay, the facial nerve fiber which winds around the Abducens nucleus to form the genu. Okay, so this is the genu here, internal genu here, which form the facial colliculus in the floor of the fourth ventricle here. Okay, so this fiber winds around the Abducens nucleus, come ventrally and comes at the junction of the pons and medulla just above the olive. Okay, here. So this is the facial and this is the Abducens nerve come from the ventral aspect at the junction of the pons and medulla at the pyramid or just above the pyramid. Clear? And further here we have seen the vestibular nucleus here. This is the vestibular. This is the vestibular nuclear complex, which is made up of the superior, medial, and the medial and lateral vestibular nucleus. Clear? Then further here, laterally, okay, further lateral to the facial nucleus, there is a superior salivatory nucleus here, and dorsolateral to the facial nucleus here, there is a nucleus of the solitarius or tractus solitarius, which is the tense sensation ends. Okay, and the midline here, the two tracts are here in the midline paramedian position, the medial longitudinal fasciculus and the tectospinal tract here. So these are the two paramedially placed tract here. Clear? So this is the cross section of the pons at the lower level, at the facial caliculus level, we can say. Clear? Now the second section here, we will see the section at the upper level. Upper level means here we have seen at the locus ceruleus level, superior cerebral peduncle come, and also the this fifth nerve nucleus comes. Okay, here at the upper level, the nuclei of the trigeminal nerve to appear here. Okay, what are these? Look here. Now first outline the this is the pons. Okay, this is the middle cerebral peduncle, completely seen here. The no inferior cerebral peduncle now here. Okay, and this is the cavity, small cavity of the fourth ventricle is seen. Okay, here. Now, in this, what you will see here, now the blue color. Okay, here. These are the fiber of the Pontine nuclei here, which come from the opposite side and reaches toward the middle cerebral peduncle. Okay, like this. Clear? And these are the Pontine nuclei. Red color are the Pontine nuclei. Clear? Now, in this, at this level, then the no trapezoid body, because the trapezoid body and the inferior and superior olivoid nucleus is seen here at this level, in the lower level. Okay, there's no trapezoid body because already trapezoid body ascends upward now from the this lateral lemniscus. Clear? Now, in this here, just color combination here. Now, here, this anteriorly. Okay, anteriorly that a chain of the lemniscus systems are seen here, which form the necklace. Okay, around the paramedian position here. This is the medial lemniscus. Okay, here medial lemniscus. Then green color here. Okay, this is the trigeminal lemniscus. Clear? Then the red color, this is the spinal lemniscus. Here on the opposite side, same. Here, trigeminal lemniscus. And here, this is the spinal lemniscus. Okay, and here the green color. Okay, now here, this is the lateral lemniscus. Okay, this lateral lemniscus carry the fiber of the auditory pathway here. Clear? Now, these are the lemniscus system here. Now, further anteriorly, if you go further anteriorly in the midline here, we have seen the two tracts here. Here, just anteriorly, these are the medial longitudinal fasciculus and the I just write the name, medial longitudinal fasciculus. This is a tectospinal tract. Okay, this is the medial lemniscus. This is a trigeminal lemniscus. This is a spinal lemniscus, a lateral lemniscus. Okay, these are the lemniscus system. Important structure now appear here. The nuclei, the fifth nerve nuclei appear here. There are the two nuclei appear. One is the principal sensory nucleus and one is the motor nucleus. Principal sensory nucleus is present on the lateral side here. So this is the principal sensory nucleus. Okay, here. This is the motor nucleus. Clear? Here. Motor nucleus. Same thing here. On the opposite side. Principal sensory nucleus and the motor nucleus. And medial to this, there is a central tegmental tract we have seen here. Okay, the fifth nerve here and here. This is a central tegmental tract here. Clear? Here. So just on the medial side. Okay, here. This is a central tegmental tract here. Clear? Here. And another nucleus present the fifth nerve. This is the here the mesencephalic nucleus. This is here. Just here the cavity, just lateral to the cavity of the fourth ventricle here. This is the superior cerebral peduncle. These are the two superior cerebral peduncles are here. Okay, and these are the these are the two ventral spinothalamic tract. Okay, these are the ventral spinothalamic tract here, which now enter into the superior cerebral peduncle. Ventral spinocerebellar tract. These two tracts are here. These are the ventral spinocerebellar tract. Okay, here. So this is here, and this is the inferior cerebral peduncle. Inferior cerebellar peduncle here. Clear? And this is the here the mesencephalic nucleus. Mesencephalic nucleus here. Okay, which is in the line of the here this principal sensory nucleus. Okay, here, and the mesencephalic nucleus and the spinal nucleus of trigeminal tract are in the one line here in the cross section here. If you see the mesencephalic nucleus, principal sensory nucleus, and the spinal nucleus of the trigeminal nerve are in the one line here. Now anteriorly here, this is important. Look here, this here, this one, the green color here. This is now the nucleus ceruleus here. This green color is nucleus ceruleus. Okay, and this nucleus ceruleus, I told you, it is present in the upper part of the sulcus limitans. Okay, here we have seen here upper part of the sulcus limitans here, the bluish color area. Okay, here, which is made up of the adrenal fiber. Okay, and in between here, this area. Okay, here, especially this area. This is the reticular formation, and also here in the upper part here. Okay, here. This is in the cross section. This is the reticular formation of the pons. Okay, so this is the reticular formation. Okay, this blue color. Now here you can see here, this is the principal sensory nucleus of the fifth nerve. So the fifth nerve comes here, and the motor nucleus, the motor fiber comes. Okay, so the sensory fiber and the motor fiber here. Clear? And this fiber here end into the ganglia. Okay, this is the here the trigeminal ganglia where the three nerve comes out here. Okay, and this is the motor nerve. Okay, so we have seen here, and the pons, the two trigeminal nerve have the two roots. The medial small motor root, lateral large sensory root here. So through the sensory root, this attached to the trigeminal ganglia, and from the trigeminal ganglia, the three division, three nerves comes out here: the ophthalmic, maxillary, and the mandibular. Clear? So this is the cross section of the upper part of the pons, where we have seen the two or three specific feature. One is the here the superior cerebral peduncle is seen here. Okay, so this is the superior cerebral peduncle. Clear here, and the mesencephalic nucleus, and the two another nucleus, the principal sensory nucleus and the trigeminal nerve. Okay, here is seen. Okay, and the locus coeruleus, the nucleus of the locus coeruleus is seen here, and the spinal nucleus, this lateral lemniscus is completely formed here. Okay, which is now these are the fiber ascends upward. Okay, and from the fiber of the auditory pathway passes through the this nucleus of the trapezoid body and then ascends upward and to form the this lateral lemniscus here. Okay, so these are the structure which is seen in the upper part of the pons. Clear? Now, what is the clinical anatomy of the pons here? It's very important clinical anatomy here. Pontine hemorrhage. Pontine hemorrhage is due to the here the blood vessels which supply the pons, they are ruptured inside the pons, and rupture of the pons here, the paralysis occur, complete paralysis occur due to the loss of the cortico-spinal cortico-bulbar fiber here. Okay, one thing. Second is this reticular formation. The reticular formation which is responsible for the consciousness and autonomic fiber. Okay, autonomic fiber descends downward here, and so patient may enter into the coma. Okay, here, and there may be the pinpoint pupil. Okay, because the hypothalamus, this autonomic fiber descends downward and supply the dilator muscle, and the pyrexia develop. Okay, because there is a loss of the temperature regulating system in the pons, because these fiber, the reticular fiber ascends upward and activate the hypothalamus here. So the pyrexia develop. So the three features occur: the paralysis, the pinpoint pupil, okay, and the pyrexia. So these are the feature of the pontine hemorrhage. Okay. Then second is the Fowell syndrome. What is Fowell syndrome? When the blood vessel which supply the dorsal part of the pons and especially supply the here this area, the facial nucleus and the abducens nucleus here. Okay, this one here. So what's happened? The facial paralysis occur and the abducens paralysis occur. Okay, here. So this what's happened? The facial paralysis. Okay, here the lower motor neuron paralysis occur here, or the half of the one side of the face is paralyzed, and the this lateral rectus muscle is paralyzed due to the abducens nerve here. So what's happened? There's a gaze defect occur here, and also there's a paramedian reticular formation is affected here. Okay, here this paramedian reticular formation is responsible for the conjugate movements of the eyeball here, along with the abducens nerve here. So in the Fowell syndrome, the facial paralysis of the half of the face of the same side and the lateral rectus muscle paralyzed. So horizontal conjugate gaze defect occur in this Fowell syndrome. Okay, so this is a Fowell syndrome. Clear? The next syndrome is the Raymond syndrome. Raymond's syndrome. Okay, what is Raymond syndrome? Raymond syndrome is here when there is a basal part here. Okay, here this is the basal part. Okay, the blood vessel which is especially here. Look here. This is the basilar artery. Okay, and this basilar artery supply the paramedian branches. So the paramedian branches and so the short circumferential branches. Okay, here. Short circumferential branches here, and also in the deeper part here. Okay. So in the Raymond syndrome, what's happened here? There is the blood vessel which supply the this paramedian position of the pons here. So the short circumferential branch and the paramedial branches. Now these paramedial branches supply the pyramidal fiber or the corticospinal fiber along with the abducens nucleus here. Okay, here abducens nucleus. So the what's happened due to the paralysis of the corticospinal fiber, which are the cross here. Okay, suppose this fiber passes here. So this fiber crosses in the pyramidal tract here. So what's happened? Opposite half of the body paralyzed. Okay, while the abducens nucleus, okay, abducens nerve of the same side paralyzed. Okay, so what's happened? The lateral rectus muscle of the one side paralysis occur and the opposite half of the body is paralysis. So this is now the alternating. This is also known as the Raymond syndrome. Is also known as the alternating abducens paralysis or hemiplegia. Okay, hemiplegia, alternating abducens hemiplegia, where the one side of the abducens nerve and the opposite side of the body. Now, fourth one is the Millard Gubler syndrome. Okay, Millard Gubler syndrome. This is also known as the alternating facial hemiplegia. Alternating facial hemiplegia means what's happened now here, the pyramidal tracts are same paralyzed, are damaged here due to the obstruction of the arteries, but here now the facial nerve paralysis occur. Facial nucleus is paralyzed due to the thrombosis of the blood vessels which supply this facial nucleus here. So the facial nucleus paralysis occur. What's happened? Half of the face of the same side paralyzed, while the opposite half of the body paralysis occur. Okay, here. So this is known as the Millard Gubler syndrome. Okay. Another syndrome occur here, called lateral part of the pons when are damaged. In this, what's happened? These pyramidal tracts is also paralyzed here. Okay, along with the trigeminal spinal nucleus of the trigeminal nerve here, and this is known as the alternate trigeminal hemiplegia. So in this alternative trigeminal hemiplegia, what's happened? Here, due to the paralysis or the damage of the motor nucleus and the sensory nucleus here. Okay, motor nucleus and sensory nucleus of the trigeminal nerve, along with the here the corticospinal and corticobulbar fiber which descends downward here. So what's happened? There is a same side of the face. Okay, here the sensation from the same side of the face are lost, pain, temperature and touch, and along with the paralysis of the masticatory muscle due to the this paralysis of the or damage of the trigeminal nucleus here. Motor is the principal nucleus, while the opposite half of the body is paralyzed. Okay, due to this descending fiber, the corticospinal fiber descend downward and crosses from the pyramidal decussation and supply the opposite half of the body here. Okay, so this is known as the alternating trigeminal hemiplegia here. Okay, where the one side of the face sensation, general sensation are lost along with the paralysis of the masticatory muscle, and opposite half of the body is paralyzed. It's the loss of the corticospinal tract. Clear? And the last is the cerebello-pontine angle tumor. Okay, what is cerebello-pontine angle tumor here? At the junction of the, here we have seen here at the pons and the medulla here, and here it is the cerebellum here. If you draw the diagram here, suppose here. This is the midbrain, pons, and the medulla, and behind there is the cerebellum. Okay, here these are attached with the cerebellar peduncle here. So at the junction of the cerebellum, pons, and the medulla, in this area, okay, in this area, when there is a tumor occur, especially the tumor is occur of the vestibular nerve, the vestibulocochlear nerve. Okay, here. So vestibulocochlear nerve tumor when occur here, vestibulocochlear tumor here, and this vestibulocochlear tumor ascends upward and compress this angle, and especially here the this 8th nerve and the 7th nerve, okay, and the inferior cerebral peduncle and the middle cerebral peduncle area here. Okay, here. So these areas are compressed here. Okay. So the defect occur here. So what are the symptoms of cerebellopontine angle tumor? There is a deafness occur, or the vertigo, loss of the equilibrium sense occur here due to the vestibulocochlear damage here, and there is a persistent tinnitus due to the irritation of the the cochlear component of the vestibulocochlear nerve. Clear? Then the cerebellum here, the middle cerebral peduncle is defected here, and so there is a symptom of the cerebellar dysfunction, ataxia, adidochokinesia occur here, and the tremors, okay, intentional tremor here due to the cerebellar dysfunction here. Clear? Then ipsilateral loss of the pain and temperature fiber here of the face, and due to the damage of the trigeminal tract and the trigeminal nucleus here. The trigeminal nucleus present here. Clear? So ipsilateral loss of the pain and temperature of the face and the forehead, and a contralateral loss of pain and temperature of the opposite side. Okay, due to the damage of the spinal lemniscus here. Okay, due to the damage of the trigeminal tract and the trigeminal nucleus of the trigeminal tract here, spinal lemniscus here. What's happened? Now the loss of pain and temperature fiber from the same side of the face and the opposite half of the body here due to the damage of the spinal lemniscus here. Clear? So this is the another manifestation. And the last manifestation, when here the facial nerve is paralyzed, facial nerve is affected here. So facial nerve paralysis occur, or the lower motor neuron paralysis occur, means half of the face is paralyzed on the same side. So these are the manifestation of the cerebellopontine angle tumor, where the defect damage of the vestibulocochlear nerve leads to the deafness and tinnitus, okay, and the loss of equilibrium, and the cerebellum fiber are lost here, the middle cerebral peduncle, inferior cerebral. So there is a defect in the cerebellar function, there is a intentional tremor, okay, ataxia, adidochokinesia, and further upward here is a nucleus and the tract of the trigeminal nerve is damaged, and the spinal lemniscus is damaged. So what's happened? Pain and temperature of the half side of the face, same side of the face is lost, and the pain and temperature from the lower half of the body of the opposite side is lost due to the spine loss of the damage of the spinal lemniscus here. And further here, if the tumor encroaches the facial nerve and the facial nerve nucleus, the facial nerve paralysis occur, the lower motor neuron paralysis occur, the half of the same side of the face is paralyzed. Okay, so these are the symptoms occur in the cerebellopontine angle tumor. Clear? So I think this is all about the pons. The cross section we have seen, the cross section of the pons at the upper lower level and the upper level here, okay, and the clinical anatomy. Thank you.